So I interviewed my girlfriend and I asked her probably about 6 questions, and I was pretty thoroughly impressed. The first question I asked was, "What is your occupation?" And she stated that she works as a CNA at an assisted living in New Prague, Minnesota. She's been there for about a year and a half now, and she's also attending Rasmussen College, just in Mankato, for the RN program. The second question I asked, "How long have you been in the occupation?" She said she started when she was 16 years old and she's currently 20. She was offered a job at a local assisted living here in Lee Center, which is actually right down the street from us. She worked there for a couple years, and that's kind of where she fell in love with the nursing profession. These first 2 questions, she did seem pretty confident in her answers, and she was proud of it. The third question is what do you think is the best part of your job? She thinks is just being able to care for other people's loved ones, make sure that we're treating them the way that they deserve to be treated. And sorry, I'm not very good at this yet. And she likes taking care of them in their final days to make sure that they are comforted and that they're at peace, which is also very challenging at times. You grow to have a relationship with the person. The least favorite part of her job is being short-staffed or watching one of her closest residents pass away. Being short-staffed is hard anywhere, but especially in healthcare, because you're taking on what should be three people's work, and you're doing it all yourself, which is very tiring. Then the next question was, please tell me about an interesting event or an occurrence that happened at your job. She had this resident and her son was visiting, and this resident pressed her call button, which was very unusual because this lady never calls, and that was pretty alarming. The resident's son was actually having a seizure on the couch, and you don't really know what to do because they're not your resident. You don't know anything about them really, so she just called 911 and waited till EMS arrived. And the final question was, what advice do you have for someone interested in pursuing the same career? The best advice I have for someone who wants to pursue a healthcare career is always just keep your head up, listen to your patients, and listen to the family members, and always work your hardest. There's always something that needs to be done working in healthcare. Here's some of the things I would have liked her to do, which was, what does a typical day look like? What her pay rate is. The information seemed very honest. It was very open with on how much she could share legally. And she's just a young woman trying to gain the most experience she can before she graduates to be an RN. And I'm very impressed with that.